Mumbai seems to be a city hardest hit in India. The coronavirus cases cease to go down, and there are now new cases being reported in different parts of Mumbai. Today we found that 21 sailors in the Western Naval Command area of Navy Nagar have reported positive. Although reports do suggest that they have not come in contact with people on submarines or on ships, but that also needs to be further investigated. Even 40 days after the detection of the first COVID-19 case in Mumbai, the state government seems to be struggling, however, right now to get its act together. And that is despite putting so much of an effort. So, tremendous effort by Uddhav Thackeray and his team. It's really something to commend. Yet there is a growing sentiment now that probably, since the cases are increasing in the slums of Dharavi and Govandi in Mumbai, it may be appropriate for an army deployment in these slums. Now, how do the numbers really add up? With 1936 cases distributed pretty much equally across the city of Mumbai, and with the slum clusters of Dharavi and Govandi emerging as the new hotspots, anyone who knows Mumbai well would know that the damage the city is staring at. Worli, with nearly 400 cases, by the way, is Aditya Thakeray's constituency. Something to make him concerned. Now, what makes the situation intriguing is the unabated, relentless rise of new containment zones after 24 days of lockdown. Maharashtra, do not forget, has been in a lockdown since 22nd of March, which obviously makes it contemplative as to what's really going on. Maharashtra and Kerala were nearly at the same level 2 weeks ago. Now, as Maharashtra struggles, Kerala has been able to successfully flatten the curve. Let us look at the critical components: the medical preparedness and the lockdown effectiveness in combating the coronavirus, and how they have failed miserably so far. Maharashtra now accounts for 23.9% of the total COVID-19 cases in India. That's pretty substantial. It also accounts for 44.3% of the total COVID-19 deaths. In fact, the mortality rate in Maharashtra, 6.5 to 7%, is higher than the global average of 3.4%. That's something pretty alarming and something to really make note of. Considering that Mumbai is equipped with better medical facilities than most other parts of India, there could be only two plausible reasons for the high mortality rate in the city. One is poor medical preparedness in hospitals to fight COVID-19. The other is perhaps a much higher number of undetected cases. Most hospitals chosen to treat COVID-19 patients were ill prepared, it seems. The COVID-19 sections in the hospital required foolproof segregation, which did not happen. Instead of getting all or most of COVID-19 patients under one roof or two, they were scattered across the city. This explains why one of the largest numbers of hospitals shut due to COVID-19, as well as large number of infected medical professionals, is in Mumbai. In fact, one can understand that the Maharashtra government has been facing a really uphill task. There are poor conditions in isolation wards, and this pretty much sums up the ground situation, which is really pathetic. Despite the availability of adequate protective equipment and the PPEs in Mumbai, these PPEs are not really reaching the hospitals as quickly. Neither has it been able to provide proper security in these COVID-19 hospitals. Even on 15th of April, when India entered the second phase of lockdown, another unsavory episode of mismanagement was reported from Jules Cooper Hospital. Apart from the hospital challenges, as of today, 3 large police colonies in Mumbai stand sealed, demoralizing the city's police force. And this is pretty surprising that starting 12th April, testing protocols have been abruptly changed in Mumbai. Now, non-high risk contacts will not be tested. Considering that 65% of Mumbai's coronavirus patients have been asymptomatic, one can imagine the grave danger that this alteration of the definition of who will or will not be tested carries. It also goes against the guidelines of the Indian Council of Medical Research, the ICMR. So things look to be rather grim, and one can imagine at least that the cases are increasing. The slums and where things are getting really out of hand, probably sooner or later you may need testing to the extent of lakhs of people to be able to get over the situation. Otherwise, this is a never-ending spiral. One thing will lead to another, and it's a vicious circle which you will never be able to get over. Testing will be the real answer to contain the cases of coronavirus in Mumbai city. And for that, you need to have more testing kits, also to be able to maintain discipline and protocol, social distancing. Sooner or later, I think, at least in these 2 areas of Dharavi and Govadi, you may need army deployment. I'm saying it's a tough call, but probably. Neither am I saying or suggesting this is just a food for thought. Having said all this, I have said many times that the Maharashtra Chief Minister Uddhav Thackeray and his team are doing a fabulous job, and how pleased I and others who are residents of Mumbai are with his tremendous contribution in a very difficult time for the city. Take care. Bye-bye.